Okay, so this is going to be part 2 of the Disastrous Health video that I was putting together. And what I want to do now is tie the idea of the built environment with the concepts I was talking about before, natural disasters in health, housing in health, and how all of that relates back with the mission, vision, and values of Habitat for Humanity and the work that I was able to do over my reading break. So to do this, I kind of want to talk about what is the built environment, tie it back to some course concepts so you can understand the health implications of the built environment, and then I kind of just want to close with some reflective questions or parallels that were coming into my head while I was doing the research and putting this information together, and it's kind of things that came up for me and made me think of this topic that I very much enjoy. So first, if we look at the past and we kind of backtrack and see where health has come from, we know that the aim of both public health and city planning was to combat infectious disease as it had spread in the rapidly growing industrial cities. In the 19th century, there was high rates of cholera, tuberculosis, dysentery, and it was the goal of civil engineering or urban planning to combat these diseases. If we move forward and look at where we are now in the 21st century, we can see that these are not necessarily problems that we face right now in Western society. We've probably moved past them because of infrastructure, sanitation, waste removal, those kinds of things. But we are still seeing research that indicates that there is a direct link between our built environment, our infrastructure, where we live, work, play, carry out our lives, and health. But there is a shift that's being seen. So we're no longer looking at health and communicable diseases or infectious disease. We're looking at health and non-communicable disease or chronic disease. So there's a direct relationship between where we live and our instances of cardiovascular disease, chronic respiratory disease, diabetes, etc. And what we want to talk about is that this research is generally based on an ecological model of health behavior and conceptualizes the built environment at a variety of levels. And it takes aspects from the single room where you live, work, and moves all the way out and encompasses features of your local transit system. Now, to kind of give an idea of like a definition of the built environment, in a research article about understanding what the built environment is, Williams explains that the term built environment encompasses all the physical structures and elements of the human-made environment in which we live, work, travel, and play. So when you're exploring these concepts of the built environment, it's maybe able to provide a little bit of clarity as to what it means in the context of our contemporary city buildings, how it interacts with other social determinants of health, and how some of these interact with our daily lives. So to do that, I'm going to say like the design and layout of a given environment can contribute significantly to our psychological and physiological health and well-being. This is due to the availability, quality, and placement of the components in our environment. And these are things such as the various forms of infrastructure, the placement of recreational facilities, parks, and the lighting of city streets. At the bottom line, all of these things work intrinsically and synergistically to affect the quality of our lives. And in order to delve into these health implications a little bit more, I want to look at it through two different lenses that were brought up in class. So the first is going to be the socio-political health promotion lens, which emphasizes the social conditions and contexts that influence someone's health. And then the other lens that I want to look through is the behavioral health promotion one. And that is the one that emphasizes lifestyle and behavioral choices and factors. So moving forward, we're going to start with socio-political. So starting from a socio-political lens, we know that the built environment is not exclusively public or private. It does not fall under the jurisdiction of a single government agency, nor does it fall under the purview of a single level of government. And this is because the topic is wide-ranging and takes into consider a varied group of stakeholders. And this is because it ranges from things like your private residence to the maintenance of roads, all the way to the policy surrounding the proper disposal of toxic substances and wastes. Now, as the built environment is developed and managed, a varied group of stakeholders takes interest in this over a long period of time. And if we just look at, say, the provincial level for a second, we can see that groups like the Ontario Ministry of Municipal Affairs and Housing, Heart and Stroke Foundation of Ontario, the Ontario Professional Planners Institute, and the Ontario Healthy Communities Coalition would all have a vested interest in this idea. They are a varied group of people, all with one goal. So together they would jointly consider how the built environment affects health, and they would collaborate with one another as well as other agencies and community partners to develop research, policy planning, and practice to advance the knowledge around the built environment and how it affects people's health. And then another topic that actually came up while I was doing this research, which I didn't actually think of before this, but it's really a forward-thinking idea, is that the idea of gas prices, active transportation, and how this affects policy decisions. So it was noted that with ongoing societal changes such as obesity and climate change, the resulting concern around active transportation as being a healthy mode of transportation may actually get its chance as a policy window with the swift rise in gas prices. And this is important because it may open a policy window for advocacy groups to get their concerns for access to active transportation onto the policy agenda, because the government is, at the bottom line, concerned about money. So how do we save them money? We can focus the idea on active transportation, and then we can tie it back to how this could save them healthcare dollars in the future. So it's like a win-win situation for them. And I thought this was a really cool way to kind of tie in another aspect of the socio-political framework. Anyway, moving on, now I'm going to look at the built environment through a behavioral lens. Okay, so now we're going to shift our focus and look at the built environment through the lens of behavioral health promotion. And to start, we're going to look at this from the aspect of mental health, so psychological and social well-being. So we know that communal physical features such as paths, parks, recreational facilities, as well as safe and secure residential areas as well as employment aid in a person's understanding of social cohesion. And this means that they have a better sense of identity as an individual as well as within a community. And these can also affect their ability for social interaction, which together has an impact on their mental health and well-being. Also, we know that making public and private services such as healthcare, education, and social services more available, accessible, and affordable for people, we can increase their social and economic contributions to the community, which can help their mental health and well-being. Further, if we look at the safe, clean green spaces that are available in an area, these can actually have a profound effect on someone's mental health just for the sheer fact that trees, shrubbery, and flowers have a very therapeutic effect for people, and they can promote reflection and relaxation, which I mean everybody deserves a little bit of an escape now and again, so I feel like this is a really good feature that can really help people to, get out and just get some fresh air. Then if we shift our focus a little bit and look at it from another aspect, we'll look at it from the idea of physical health. So we know that the built environment can affect a lot of aspects of our physical health, but one that's really been researched a lot is the built environment and physical activity. And we know that safe street networks, ample lighting, close proximity to residential and commercial areas all have an effect on someone's physical activity in the built environment. The positive health implications of increased physical activity have been also very well documented, and we know that these are things like increased muscle mass, increased bone density, and the strength and flexibility of our joints, which has long-term health effects in reducing things like chronic disease such as hypertension and osteoporosis, which can increase mortality and morbidity, and can also have a detrimental effect on our healthcare system in terms of dollars. Further, we know that in terms of a physical setup of an environment, some populations are disadvantaged in the way that they have an increased number of what is known as mom and pop organizations. So these are things like Max Milk, 7-Eleven, McDonald's, other fast food restaurants that are very well concentrated in their area, and there's actually not a high number of fresh food markets or grocery stores, and it forces people to have to eat poorly because of what is offered in their area. So a built environment that is clean and better for promoting health is one that makes supermarkets, fresh produce, green spaces accessible and easy for people to get to within a given environment. And another part of research shows that since land use and transportation decisions sometimes compromise the quality of shared resources like air and water, researchers have also extensively explored links between the built environment and environmental toxins and poor health. There is hope, though, however, if you think about it. Trees or green spaces do a lot for our environment, and they clean up our air. So these green spaces can greatly minimize the negative health outcomes, such as premature death from heat or smog, and they can also clean the air and filter out toxins and stuff like that. So these aspects are how the built environment affects our health. Moving on, I'm just going to close up and say a couple words. Okay, so now that I've had the opportunity to go through all the content that I want to cover for this video, I'm going to end by just giving some reflective questions that came to my mind as I was going through this information and trying to make parallels between the concept of the built environment and how people's health is affected through rehabilitated housing following a natural disaster. So some of the questions that had come to my head were, how is the built environment considered following a natural disaster? Is it considered? Is it a priority to people when we're trying to rehabilitate communities? What is the ill health effects of living in a refugee camp for an extended period of time? Has this been researched? Are we subjecting people to furthered ill health effects by the way we organize or rehabilitate a community? And then the final thought that I had was, are these living conditions that we're providing for people following a natural disaster conducive to mitigating some of the ill health effects that they experience because of what they've seen during the disaster? So these may be mental health effects because of the chaos and devastation that they've seen, or some of the physical ailments that they may have, or the infections that they may get. So I hope that this has been an informative video, and I hope that you're able to kind of think about those questions and reflect on them the way that I was able to, and maybe see some of the parallels that I was able to make for the content. But anyway, thank you for tuning in, and I'll see you guys next time.